second week of the 2018 Kentucky General Assembly saw slowed legislative activity as a result of the House and Senate canceling all Friday activities due to the impending winter storm and the continued fallout from the sexual harassment scandal. However, several KMA priorities are scheduled to be heard in front of committees, and members are being asked to engage with their legislators to support their passage. House Bill 4, introduced by Representative Adia Wuchner, would protect the peer review process to allow physicians and hospitals to assess their work without the possibility of their words being used in a medical malpractice claim. The bill has been posted to committee and is likely to be heard Thursday by the House Health and Family Services Committee. Your help is needed to ensure this important legislation is passed. Call your representative and ask them to support House Bill 4. Another KMA priority bill, Senate Bill 20, introduced by Senator Ralph Alvarado, is expected to be heard before Senate Health and Welfare Committee this Wednesday. This omnibus medical malpractice legislation would require an affidavit of merit at the time a claim is filed, would place caps on plaintiffs' attorneys' fees, establish legal confidentiality for medical peer review discussions, and prohibit expressions of sympathy, compassion, and benevolence from being used against a healthcare provider in medical malpractice claims. Another KMA priority, Senate Bill 2, also sponsored by Senator Alvarado, proposes an amendment to Section 54 of the Kentucky Constitution that would limit monetary damages for injuries or death to person or property. If passed by lawmakers, the amendment would be presented to Kentucky voters for ratification during the November 2018 general election. A hearing on Senate Bill 2 is expected soon. Senate Bill 20 and Senate Bill 2 would together significantly improve the legal liability climate in the state. Please call your senator and ask them to support Senate Bill 20 and Senate Bill 2. KMA is closely monitoring several other pieces of legislation that would have an impact on public health and the overall practice of medicine. Senate Bill 79, introduced by Senator Ralph Alvarado, addresses balanced billing. Senate Bill 29, introduced by Senator Stephen Meredith, seeks to place a $1 health care assessment fee on cigarettes and other tobacco products, including e-cigarettes. And Senate Bill 6, filed by Senator Alice Forgy Kerr, would require pharmacists and prescribers, each time a controlled substance is sold or distributed, to sell or provide to patients a non-toxic product whose purpose is to permanently capture unused controlled substances so that they can be disposed of properly. KMA is also asking members to be sure and register for Physicians' Day at the Capitol, scheduled for Wednesday, February 7th in Frankfort. The day will begin with a legislative breakfast and briefing at the Capitol Annex building, followed by visits with legislators and lunch at a feedback session at the Kentucky Transportation Cabinet. Attendees are strongly encouraged to wear their white coats to Physicians' Day. This small gesture will allow KMA members to stand out, as well as send a powerful message to policymakers by demonstrating strength and unity among the medical community. Registration, as well as more information about Physicians' Day, is available at kyma.org. And don't forget to subscribe to the KMA Legislative Alert and follow KMA on Twitter, Facebook, and LinkedIn to receive timely information about these and other significant legislative issues being debated by the General Assembly.